All right. I'd like to call the meeting of Tuesday, July 6, 2021 to order of the Ways and Means Committee. Roll call. Oh, here she comes.
She's got no more casual.
Roll call, please.
She's doing a great job. I should.
Here. Here.
Here.
Here.
Here.
Johnson.
Here.
Krieger.
Yes.
All right. Are there any changes to the agenda? Right, hearing none, is there approval of the agenda as submitted?
So moved.
Support?
Support.
Any discussion? Roll call, please. Oh, you don't? Oh, wait, all those in favor, because we're all here. All those in favor?
Aye.
Opposed, same sign? I keep forgetting that. Okay. Is there a motion for approval of the minutes?
So moved. Support.
Moved and supported. Any discussion? Did you catch those, Deanne? Okay. All those in favor?
Aye.
Opposed, same sign? Okay. Item 6, public input. Anyone wishing to speak to the commission, please go to the podium, state your name and address.
My name is Pat O'Shea, 103 Maplewood Court, and I'm here on behalf of the Bay Area Pickleball, and I would just like to thank the commission and the county very much for donations. We got the courts done on Friday, and they started playing them on Monday, and they were packed all Monday morning until it got hot. Busy again today, so I'd just like to come and thank you, and we appreciate the help. Thank you.
Thank you.
Thank you.
Anybody else wishing to speak? Okay, moving on to petitions and communications. Mr. Manning, you're up.
I'm up. Thank you. My name is Dan Manning. I'm with Connect Michigan. If you're not familiar with us, we're a nonprofit organization supporting broadband across the state. We're not really directly affiliated with the state of Michigan government, but we are a nonprofit. We've got a national nonprofit, has the same mission, just to help expand the access and adoption and use of broadband across the state and across the country. And I was asked to come and kind of chair a discussion about broadband, if you will, and share some information about broadband or high-speed internet connectivity across Bay County. So I've got a few charts that I can kind of share with you through the screens here and take you through some of that information. And but I'd like to keep this kind of informal. If you have some questions as I go through this, please don't hesitate to stop me, and be glad to answer any questions. And then we can certainly have questions at the end of this as well. I expect it'll probably take 10 or 15 minutes. Does it sound reasonable to do that? And I'll take you through that information and we'll go from there. Okay. First of all, whenever we talk about broadband, there's a lot of different definitions. People have different impressions of what it really is. And broadband, as it's defined today, is something that gives you connectivity out to the internet, if you will, at a minimum speed of 25 megabits down, which is a download speed, data coming down the line to you, and 3 megabits upload speed. So if you're sending something, that's considered to be the upload speed. This is kind of the standard. It used to be 3 megabits. It used to be 1 megabit. It used to be back in the dial-up days, it was 56K, if you remember back then. So things have gradually increased as there's been more and more demand, and we're doing more applications online, more and more people online for education and for work and everything else that's really driving that. But this current definition of 25 megabits speed is set by the FCC, and that's something that at a minimum we're trying to get everybody to across the country. And I say we, it's the FCC, it's the federal government through a number of different programs that it has, as well as all the local efforts working with local providers to make that happen. But broadband itself can be considered available through a number of different platforms. It can be delivered through a number of different technologies, including fiber. If you have fiber direction or a fiber connection direct to your home, that's the ideal, kind of the Cadillac, if you will, to give you all the speed and capacity that you might need. Cable is another one. So if you're using your cable modem and have a connectivity through your cable system, you can get broadband speeds that way as well. There's also also a DSL connection, which is used in the old phone lines through companies like Frontier and AT&T and a number of the other older companies, other older telephone companies. And then there's also this fixed wireless connection, which is transmitting from towers down to receivers at your house through companies like Air Advantage and AgriValley and Speed Connect and companies like that. Those are the primary platforms that we really focus on. But in addition to that, you also have the ability to get online through your mobile broadband connection, through a smartphone, through the cellular companies. We call that mobile broadband. And then there's also the satellite systems that are available kind of as a last resort for people that are out in very rural areas where it's difficult to get signals any other way, but they transmit from satellites down to the earth and back to give you connectivity that way through companies like HughesNet and Viasat and a few others like that. There's a new development on the satellite front with something called I'm drawing a blank. Elon Musk's company, Starlink, is the new one, which is considered a low-orbit satellite, closer to the Earth. It's like a series of satellites that he's putting up to deliver internet service, which is now starting to become available across the state of Michigan and across the country. So that's also becoming a more viable platform for getting connectivity that way. So just to give you a little background as to what we mean when we talk about broadband and what the different platforms are that it supports. This particular chart here gives you kind of a graphical representation of what broadband coverage looks like currently across Bay County. This is by no means precise, but it gives you a general feel for where there's broadband service available at this 25 megabits download speed capability. All the green areas that you see on the map are where that speed is at least available to a resident or to a business if they wanted to subscribe for it. A lot of this is being provided by Charter, Spectrum through their cable service, but then you also have a number of other companies like AT&T, like Frontier in some cases, Air Advantage, a number of other companies that can provide that speed are all also represented on this map. So as you would guess, we're in the more populated areas, especially around Bay cities, where we tend to have the best service and the best coverage overall. And you get up in the northern part of the county, it becomes a lot more sparse, a lot more rural, more expensive to get equipment out there in order to make that happen. So that's where we currently sit. This data that generates these maps is supplied by the actual broadband providers that are providing that service. So all those companies that I mentioned, twice a year they have to send their data to the FCC that shows where their coverage is and what kind of speeds that they're providing. And the FCC translates that into maps like this that we work on and try to refine them to make it a little bit more accurate. So again, they're not precise, but they give you a general idea of coverage.
What is the darker green in the bottom right?
Oh, good question. Yeah, down in the southeast corner there, in the darker green, wherever you see the darker green is where there's areas that our company, Connect Michigan, has gone and validated that that service is actually there, and we have much more confidence in that than some of the other data that's there. And that's been one of the issues with generating these maps is that the providers will provide that data, but there's not a lot of validation and scrubbing going on with that data to make sure that it's accurate enough. We try to do that wherever we can. In this case, just down in the southeast corner is the only place we've done it in Bay County to this point. Question here?
The shaded area, which are mostly rural areas, does that reflect the satellite and even the new technology, the lower satellite?
No, it does not. The green areas that you see on the map reflect the service being available either through fiber, cable, DSL, or fixed wireless. It's just one of those four platforms that I mentioned that are what we consider fixed broadband platforms.
So how effective would these folks in the rural areas have the opportunity to have some connectivity with the satellites? Whether the higher satellites or the lower satellites or new technology, well, it should be coming in the whenever.
Well, frankly, satellite technology is available to just about everybody across the country. The question is, can you get a line of sight from your home directly up to the satellite? So if you're in an area that's just covered by trees and you can't get that signal, then you got problems and you have to look for another way of getting that service. The Starlink that's coming from Elon Musk is a little bit better because the satellites are lower, the distance is less than from the home to the satellite, and there's more satellites out there delivering more of a mesh kind of arrangement over the earth to provide that service. So it's, the challenge has always been trying to get out to the more rural areas because it's expensive to run fiber all the way out there to each individual home and all that. So we've had to rely on these other technologies in order to deliver that service up till now.
It's like a Starlink, would that be the same thing as like having a DirecTV, that kind of you'd have to have a dish, or?
It's the same concept, but it's a better system because, again, the satellites are lower and closer to you, and there's more of them, so there's less chance of you losing a signal due to bad weather or trees and things like
So
that.
that would be like in the northern section of the county, well, the whole northern section of the county, and even some a little bit below that would probably be the thing that they would use out that way. Would that be?
Well, that would be one option for them. And I'm going to share something with you that'll make you feel a little bit better about those rural areas here in a second, too. Other questions?
Just, could you give us just a synopsis of the breakdown of costs to extend that out through, what would you have, a radius of about 7-8 miles?
Well, that's kind of difficult to say. If you go to an individual broadband provider and ask them what it would cost to run a mile of fiber, for example,
It's too expensive.
yeah, they'd tell you $25,000, $30,000 to do that. So when you look at, picking an area that doesn't have any service today and trying to figure out the best solution to do that, what platform, what technology to use, and how to size all that, there's lots of different factors that go into that where it'd be kind of tough to estimate that without doing a lot of background work. Question?
Is the solution in the rural areas more towers?
That certainly helps. The more towers you have, because generally a tower might be able to send a signal maybe 5 or 10 miles in one direction. So you got a 15 or 20 mile diameter. So the more towers you have, the more coverage. But then if you erect more towers, there's more cost involved there. Then typically the companies will run fiber out to those towers in order to get the towers connected back to the internet. So it all adds up to more cost to do that. But if you're in an area where fixed wireless is the best solution technology-wise, then yes, the more towers you have, the better the coverage is going to be.
Is that what you do? Is essentially is like look at the whole situation and try to figure out what is the best?
Yeah, we try to do that. We kind of play the role in between the providers and the communities, frankly. So a lot of times the folks in the communities don't even know who their providers are, haven't had any ongoing discussions or even met a lot of them. So we try to bring them all to the table, start having these conversations about what the problems are and how can we best fix those problems. There are consultants out there that'll charge you lots of money to come in and look at an area and say, okay, back to your question, this is what it's going to cost if you decided to bring broadband coverage at this speed to this particular area. So there are companies that do that. We do some of that, but not as extensive as what a lot of other consulting companies will do. But we're not as expensive either.
Yeah, I have a question. In your opinion, how is it that this is the 21st century and we have areas in white? I mean, broadband, it's a basic need for small business, for families,
Absolutely.
for the workforce. And that's very confusing to me.
Couldn't agree with you more. And that's the big problem that we're trying to help fix. Part of it's because of how the internet got started. It was all run and the internet was delivered by private companies like the Charters and Comcast and AT&Ts of the world. So they all kind of staked their claim initially to those populated areas and said, okay, I'll provide service here and the other company will do it here. So they went where the population centers are, where they can get the most revenue. And that's why the rural areas were kind of left off. Absolutely, they need the same level of service, but trying to get to them is going to require different technologies. And that's why some of these newer things that are coming and the price of fiber is coming down, it's making that more realistic now. And the biggest thing that's happening is that the federal government has really stepped up in the last year or two and put a lot of money behind build out in these rural areas. And I'll tell you a little bit more about that here in a second. Okay. Okay, this is the same map. This shows where there's 100 megabit coverage. This is extra high speed. So this is generally either cable or fiber, and where those available. And you can see there's more white on this particular map because there's less areas that can reach that kind of speed. The technology is not there in those particular areas. But all of these maps are available out on our website at connectmi.org, and you can get to all of this information if you want to see some of that. I thought I'd provide you with a list of who the providers are that currently give broadband service across Bay County, and you can see them here. Your cable providers are Charter and Parish Communications. DSL, again, through the phone lines. Those are the older telephone companies like AT&T, CenturyLink, and TDS Telecom. Fiber, Air Advantage is doing some direct fiber to the home in a couple of limited cases across the county. And the fixed wireless companies, again, that service through their towers are, as you see listed here, Air Advantage, AT&T, Citywide, LakeNet, M3, M33, and SpeedNet. So all these companies are available out there. They're all doing some business across Bay County. And I guess the biggest thing that I would leave you with is, if you don't already, you need to get to know these people and who they are, at least the ones that are willing to work with you and work on plans going forward for how to build out and how to solve some of these problems in the more rural areas. Okay, kind of the good news that comes out of all of this, and I mentioned that the federal government's been putting a lot of money behind rural broadband development. And they had this program called the Rural Digital Opportunity Fund, or shortened for RDOF, which is a $20 billion program that was set up last year that is really intended to do high-speed internet, meaning 100 meg or faster, build out into all the rural areas across the country. So the way this worked is that any provider that was interested in participating in this and taking some of those government funds would have to commit to build out to whatever areas needed that kind of service and didn't have that service today. And the result of that first part of that work that came out of it was CenturyLink and a company called Point Broadband, used to be Casair. This company called Point Broadband. Those two were the big winners for Bay County, and you can see where on the map the green area is where CenturyLink is going to be building out using those with federal funds as well as their own money, and Point Broadband will be doing the same in the browner areas across the county. So they're going to be bringing, in most cases, it's going to be 1 gigabit level service, high speed, very high speed service. Most of it's going to be all fiber to your businesses and your residents that are in those boxes that you see shaded here on the map. And this is all going to take place in the next 5 to 6 years. So it's a long program, but some of that build out is going to take place within the next year or two. So you'll start seeing some really good results out of that. And as you can see, a lot of it's up in the northern part of the county, which is where we know you need the help, especially. A couple other things I wanted to make you aware of. One is another thing that the federal government did is announce this emergency broadband benefit program. This is a way to combat the cost of broadband service, which is one of the big factors that are keeping people from being online today. This program will provide a $50 a month subsidy to any low-income family that qualifies, so they can get $50 a month off of their broadband bill, regardless of who the provider is, as long as they're participating in this program, and most of them are. It also gives them a $100 credit toward the purchase of a new device. So if they need to go out, if you need to go out and buy a tablet or a new laptop, you can get $100 off of that by going through this program as well. So we just want to make sure everybody's aware of this program for where it's applicable, and you can see the link to the site to give you more information about that and how to enroll. There's also a couple other big funds besides the RDOF stuff that I just talked to you about. There's another $288 million that has been set aside for rural broadband. Another $1 billion set aside for the tribes for connectivity, where they can get grants to help with any tribal communities that we have around here. They encourage partnerships between the providers and the communities to kind of get together so you can talk about which areas need to be served, and then you can both apply for these grants. And then finally, another big piece of this is I know that you're all starting to receive these American Rescue funds. that are coming down. Broadband is one valid use for those funds that you might want to consider. So if you know of a particular area in the county that you know needs help, and you've got one or more providers that are willing to work with you on doing that actual work and making it happen, we're starting to see more and more partnerships form between the counties or the townships and these providers. The communities are kicking in some ARP funds. The providers are bringing some of their own investment dollars to make those kind of projects happen. So if you're not already thinking about that, you probably should be. I think you've got like 3 years in order to spend those dollars, so you got some time to do it.
Are you aware of the latest, Chair, latest version of the infrastructure bill and how much would be dedicated of the 1.2 trillion that, I know it's still be a compromise ultimately, but do you see?
I've heard lots of numbers. I've heard $100 billion might come out of that for broadband, but I think that's still being fleshed out. But I mean, it could be as big as that. And we've already got $20 billion out of the RDOF thing. By the way, there's also going to be a second round of RDOF. All of the stuff that I showed you on RDOF there for Bay County also applies to the state of Michigan and across the country, but they only spent half the money so far. So they've got another round that they're going to go through probably another year and a half from now and spend another $10 billion for rural broadband build out. So a lot of good things coming.
One more follow-up. Yeah, I believe I spoke with Jason Allen, who was the Rural Development Director for USDA from Michigan about a year ago, and he said there was about $1 billion the USDA Rural Development had for Michigan. Do you know if any communities or counties or townships have access to?
Yeah, and I neglected to put them on the list, but USDA has their own fund, this Reconnect fund, they call it, for broadband build out in rural areas. I mean, everybody's trying to do the same thing, which is great. And we have had some grant winners across the state. I think there's some going down in Van Buren County, Allegan County, and there was a couple others, maybe down in Lenawee County. But there are actively some programs and more people and broadband providers thinking of applying for the next round of Reconnect funds that'll happen later this year. From a state standpoint, one of the things that we were pretty heavily involved with was putting together the state broadband strategy when Governor Snyder was in office. Worked with a lot of folks on his team in order to get that in place. And part of that included the development of a new broadband grant program at the state level. We've never had broadband grants available at the state before. And we've just announced the second round of winners for those grants. It's usually about $20 million a year. We just did another $14 million for a number of different broadband providers across the state, certain pockets that are working with communities to go after that too. So that's another source of funds, typically for smaller projects because dollars are smaller, but it's another avenue for smaller projects that might fit for the county or for a township. And then finally, I would kind of leave you with this. One of the things, and kind of back to the question about whether or not we get involved in helping kind of scope out some of this work and do estimates and price it all out. We do have a process called our Connected program, which involves kind of doing an assessment of what your current broadband situation is here across the county, where we would go in and do lots of surveys of individual businesses and residents to find out how they're currently connected, who their provider is, what kind of speeds they're receiving, what their needs are for the future, what kind of applications that they're using it for, who do they talk to on the internet, all those kinds of things. And then we'll take the results from those surveys, do some further analysis on that. We match it up to our maps so we can get a better picture for where the true problem areas are across the county. And then once we do that, we can zero in on more of a specific action plan for Berry County, or for where am I? Bay County. So you know specifically which areas in the county need the focus and where we can start working with providers to fill those gaps. So that's something that's available to us that we do offer if you're interested in going down that path and doing something like that. And with that, I'd just open up to any questions that you have.
A couple of years ago, NACO, National Association of Counties, came out. They have an app called Test It, where you can go actually and test your download speed.
Yep.
I just tested it here. We're at 31.24 megabytes per second here, and upload is 15.33, and standard is 25.3. So got it good here. But
So you met the bar here.
yeah. If you want to test, wherever you live at, it's called Test It.
Yeah, Test It is one. There's also one called Speed Test, which is another tool. But there's a few of them out there that kind of do the same thing. But the thing to keep in mind with those tests is that there's lots of factors that are affecting the speed that you actually see. It could be the pipe kind of coming into your house or your building. It could be limitations on your modem. It could be limitations on your router. It could be limitations on your laptop. So there's a lot of things that can get in the way if they're not all up to spec. So. Other questions? Anything I can help with?
I mentioned my friend out between Salzburg, between Mackinac and Fraser on Salzburg, so it's not that far out of the city.
Yep.
To run the cable, it's like 2,000 feet to run from the corner of Mackinac and Salzburg. It's like $3,000 above ground, but like $20,000 to be buried the cable. And AT&T doesn't serve that area, so you probably have to do the satellite type thing. That's why it's a teacher also.
Yeah, probably so. Or maybe look to one of these fixed wireless companies and see if they can provide enough speed to help her with that. But that's the challenge, again, depending on where you live, trying to find the right solution that works for you. But a lot of good news coming, and it's been a long time coming in order to get it. But like I said, there's a lot of big investment being made now to help fix some of these problems that have been sitting out there for a long time. So we're happy about it. Okay. Well, thanks for your time today.
Thank you, that was really interesting.
So I should leave you with this. You'll see in the presentation, I think we'll get it sent out to you as well. So just some links for additional information in case you're interested.
Oh, wonderful. Thank you.
Yep.
Madam Chair,
Yes.
I make a motion to receive this.
Support.
Motion, all right. Any discussion? All those in favor?
Aye.
Those opposed? Motion carried. Okay, moving on to item B. There is seeking approval for an agreement covering the home aid position.
So moved.
Support.
Moved and supported. Any discussion? All those in favor?
Aye.
Those opposed? Motion carried. Okay, item C, the Bay County Fair and Youth Exposition is seeking authorization to proceed with the project.
So moved.
Support. Moved and supported. Any discussion? All those in favor?
Aye.
Those opposed? Motion carried. Okay, item D, seeking authorization to submit the letter of intent application for a grant.
So moved. Support.
Discussion? Mr. Begic.
Just want to point out that legislation was just passed and signed by the governor that doesn't limit as much what we use this grant money for. There's some emergency funds you can use, so it's going to loosen it up a bit. Before you had to use it for buildings or construction, things like that, but it's going to open it up a bit and make it a little bit easier for us to help the veterans out.
Any other discussion? All those in favor?
Aye.
Those opposed? Motion carried. Item E, County Executive seeking appointment of Shauna Walraven to the county's 401K committee.
So moved.
Support. Moved and supported. Any discussion? Roll call? Not roll call, I'm sorry. All those in favor?
Aye.
Those opposed? Motion carried. All right, item F, Supervisor of Building and Grounds seeking approval of a request for Strasser Construction to use the Fairgrounds as a job staging site.
So moved. Support.
Moved and supported. Any discussion? Mr. Herrick.
Question, John? I see they're working, they're using it for work, so they're gonna fix it, but how much, do you have any idea what they plan on doing as far as in lieu of pay, you know, I know they're gonna pick somebody, they're
Right.
chewing some of that up, or are they?
Our fairgrounds consist of some older tardy blacktop areas and some that have been,
They're not just gonna like put a patch
they're
on?
not milling it. They're not gonna mill any of the
Okay.
blacktop, just where the gravel is, we're gonna redo that and then put the chip and seal down.
Okay, chip and seal, okay,
So probably from the front gate, right where it forks off,
yep,
back to the grandstand, and then there's a little stretch over by our dumping station, and then over by the airport.
Okay.
Around, so they plan on being there approximately 2
yeah,
days.
it needs a little. That's all I want to know, thank you.
Yep.
Mr. Barsha?
Yeah, I just wanted to, thank you, Madam Chair, make a comment while John was at the podium. Both Kristen and John, and I hope you will communicate that to the buildings and grounds staff. But I think the bench that was installed for Pam Lepic on the out, just next to the county building there by the parking lot is really a beautiful addition to the campus here at the county facility. And I think it's a tribute to her dedicated service to the county. I know she cared about everybody that worked for the county, especially all the people in this building. Such a friendly and outgoing and hardworking person. It's a real loss, her death, her unexpected death.
She's missed.
But let the staff know that I think everyone that's seen it and reacted thinks it's really a beautiful addition and an appropriate tribute to
Yeah.
Pam.
Thank you.
Thank you. Any other discussion? All those in favor? Those opposed? Okay, motion carried. Moving on to item H, the master agreement, the budget adjustments for the funding allocations with the Michigan Department of DHHS.
So, support.
Did we miss G? What one did I miss? All right, we'll circle back to that. Let's finish this one, and I'll go back.
Excuse me.
I'm so proud. You all were paying attention. Okay, so we're on H1. It's been moved and supported. Is there any discussion? I'm going to go back to that. Kim moved and Jamie supported. Okay, sorry about that, everybody. Any discussion? All those in favor?
Aye.
Those opposed? Motion carried. Circling back up to item G, Department on Aging, the Senior Service Employment Program, seeking approval for budget adjustments.
So moved.
Mr. Herrick, moved and supported by Casey Recky. Is there any discussion? All those in favor?
Aye.
Those opposed? Okay, that motion carried. Now back down to item H2, acceptance of supplemental funds for the COVID-19 response efforts.
So moved. Support.
Moved by Mr. Coonan, supported by Mr. Herrick. Any discussion? All those in favor?
Aye.
Those opposed? Motion carried. And then item H3, the transfer reserve funds to the Bay County Health Clinic.
So moved.
Moved by Mr. Krieger, supported by Mr. Coonan.
Sure. I was raising.
Any
for a question.
discussion?
Yeah.
Go ahead.
Joel, we had a nice little discussion prior to this meeting, and I brought up a question on the Bay Community Health Clinic and those dollars. So those dollars were, my question was answered, but maybe you could give a little background information to the other commissioners that weren't in that meeting in regards to what the Bay Community Health Clinic provides to the community.
Sure. The Bay Community Health Clinic is a primary care clinic that's housed here in the Bay County Health Department. There are not many health departments, only a handful that actually do provide comprehensive primary care in the state of Michigan, and we are one of them. And we've been doing this since 2015. Our clientele is primarily Medicaid, and we do this partnership with Saginaw Valley's Nurse Practitioner Program and other providers within the community. And it's an interprofessional clinic when it's fully operational, which it hasn't been really in the last year, but when it is fully operational, employs not only nurse practitioners and nurses, but social workers. It's got occupational therapy support, and support from some of the other disciplines involved as well as leaning and utilizing the services here in the health department. It's a much needed service in the community. And as we had discussed, Mr. Coonan, the number of providers on Bay County is actually dropping. If you recall, a few years ago, I updated the board. The ratio between primary healthcare providers to the general population about 2 years ago was 1 to 1,700 people. That's now about 1 to 2,500 people, and it's moving in the wrong direction. Once it moves to 1 to 3,000, you're a medically underserved area that's recognized by the federal government. And those are types of situations that you really find in remote rural areas or Native American reservations and places like that. So we don't want to move into that area, but into that category, but we're trying to do everything that we can to provide services to people that need that. So this particular program has been funded to a greater extent by grant funds that were obtained through Saginaw Valley State University, but we've been doing a fair amount of billing. But in the last year, we had to cut back on services for obvious reasons, and we're going to be adding more and more NPs and other services. And we utilize Medicaid full cost reimbursement, not only just the regular reimbursement, but the full cost reimbursement that comes as settlement funds to help operate this clinic.
Thank you, Joe.
Mr. Brennan?
And I just had to follow up at that meeting, Joel. I think it's a great program, providing care for the poor. And I don't know what the hours are, 10 to 4 or something like this. I'm not quite sure exactly what the hours are, but to me, if there's a way we could expand those hours and expand the care that we provide, whether we partner with the local hospital, McLaren, because anytime we can take some of that load off of them, it benefits them as well. So, just thinking with some of the money that we have, or just getting information, which is good because you can't make any decisions without information. If they're willing to sit down and see if we can partner, or whoever we can get to partner to expand that, to provide care for those folks, because, they get sick more often than 10 to 4. And if it's a possibility, if we're looking at expanding things or building buildings or whatever it might be, if during this time where we have a little bit of money, if it's practical to it's practical to consider it, whether it's practical to do it. So do you think there's an opportunity that we can partner and provide additional care to people in the community?
Yeah, absolutely. And that's a good question, Commissioner. We have been in active discussions with McLaren on potential collaborative strategies. We've actually had a really good collaborative relationship in the last 16 months with the pandemic. And, both sides have sat down and started to talk about it just at a basic level about how we can potentially really collaborate more and work together closely more. We're hoping that we can have some active partnerships with some of their provider groups and some of their services, and it would be great if we can do that. It's like turning a battleship, though. It's like you can't do this on a dime, but we're in the beginning stages of this, and I do think that there's a lot of room for collaboration, not only with McLaren, but with some of our other providers out there. I had a discussion today with Chris Pinner at Community or Behavioral Health about some potential collaboration in addition to that. And I think that there are other providers too that we can work with as well. And expanding services and making services that are more available to the general public is something that we strive for.
Thank you, Joel. Keep us posted on that, if you will.
Vaughn?
So I know Medicaid doesn't reimburse real well, so that's why a lot of providers don't take Medicaid. And I don't know if McLaren Urgent Care has changed their policy, but I know they weren't taking all of the Medicaid plans. I think it was Molina or some of those that don't take. So that's like after hours care for people, that don't have, if they don't take their insurance, it's not an option for them again too. So reimbursements, the bottom line for a lot of the providers just won't take the Medicaid because they don't get paid, which is all about the money.
Joel, I have a question. You said we're at 1 to 2,500 to
Yes.
provide, right? And we're headed toward 1 in 3,000, which then makes us underserved area. You have any idea when we might hit that level?
I don't think we're going to hit it in the next year, but certainly, we were at 1 to 1,700 about 2-3 years ago. We slowly crept into that thing, and then this year we were notified that we were 1 to 2,500. Now that's physicians, so but that's the way that the federal government measures how certain geographic areas serve. It doesn't include nurse practitioners or other PAs and things like that. But you have to also remember that in Michigan, nurse practitioners and other ancillary providers have to operate under the guidance and supervision of a physician. So, that's one thing that this particular county and this particular area, the Great Lakes Bay region, has been really working on in earnest in the last 2-3 years, is physician and provider burnout and recruitment of providers to this area. A lot of individuals seek care, especially specialty care downstate. They will have no problem going to Ann Arbor, to Beaumont, to St. John's, other places like that. But it's that particular primary care aspect which is becoming more and more problematic here. And as Commissioner Begic had stated, if you're a fresh grad coming out of medical school, it's going to be extremely difficult. It's an extremely difficult decision, especially if you've got loans to pay off. If you're going to come to an area like Bay County. Now, there is a lot of opportunity here to grow a practice, but there's a good number of people that are on public insurance. You get about 25% of the population that's on Medicare. You get about another 20 to 25% that is on Medicaid. And Medicare and Medicaid don't pay that well, or reimburse that well in comparison to private insurances. But additionally to that, there's a lot more lucrative opportunities in more urban areas like the Detroit metro area or Grand Rapids. So we're often overlooked here in both our region and our county. And we can't, wait for the federal government to have this magic designation. And it's not the best designation either. But we try to work with as many providers as possible and other medical organizations to try to provide care. And the Bay Community Health Clinic is one where we actually, is a partnership with us in Saginaw Valley. And as I said before, we're looking to expand that to more providers as well.
Thank you. Mr. Barsham?
Just one comment. Joel, I want to thank you for your leadership over all of the department, but also Vaughn was just mentioning, how difficult it is for people with Medicare and Medicaid to sometimes be accepted. In the hospital, you're going to because they have to accept you. But I recall, I think last year, about 2,100 people visited the emergency room of McLaren Bay for severe dental issues and abscessed teeth. And I know that opening the new dental clinic, my community dental center, has taken a big load, I think, off the emergency room visits to local providers that are really not set up to provide dental care. And that's the most expensive care you can get. But I know that the dental clinic has been widely accepted, and I think it's quite busy and doing a great job. And currently, I talk to dentists. You had worked on the program for years, developing the concept, and I talked to dentists to see if they would be opposed to expanding reduced cost dental care to the people of Bay County, but they didn't. A lot of them are very reluctant to accept the Medicaid patient because of the reimbursement rate. I think it was $17 or $20 for a dental visit. It was just totally unreasonable. And so the dentists were saying, yeah, we know people need dental care, but we also are not a collection agency. If they don't have insurance and we can't recover our costs, we hate to turn them away, but we need to be reimbursed at a rate that's not going to bankrupt us too. And some of them just do out of the goodness of their heart. They'll provide, dental care for free in some instances, but not too often. But I'd say the dental clinic out in Commissioner Johnson's district in Hampton Township, just right on the border between the city and the township, and Casey's area as well. It's going very well. Is that your understanding from the latest data? And I just wanted to compliment you because we're talking about primary care. Dental care is also extremely critical to overall health.
Yeah, it is. And we just had a meeting with all the dental centers, and one of the problems they're facing statewide is a shortage of dentists and hygienists. So one of the good things about the Bay County Clinic is that they'll get a dental appointment within 2 weeks. They're busy, but they're able to accept those appointments. However, with hygienists, it's kind of a bigger problem. Hygienist appointments are booked out about 2 months in the future. So, but it is widely utilized, and it took a long time to get that dental clinic here, and I'm really happy that it's here.
Thank you.
Any other discussion? All those in favor? Aye. Those opposed? Okay, motion carried. Item I, is there a motion for payables? Approval of the payables?
So moved. Support.
Moved by Mr. Krager, supported by Mr. Bigot. Any discussion? Roll call. All those in favor? Aye. All those opposed? Motion carried. Old habits die hard. That's all I got. Okay, moving on to item J1. Is there a motion to receive the general fund equity?
Support.
Any discussion? All those in favor?
Aye.
Those opposed? Motion carried. Item 2, is there a motion to receive the Executive Directive 2007-11?
So moved.
Support. Any discussion? All those in favor?
Aye.
Those opposed? Motion carried. Item 3, is there a motion to receive the budget adjustments?
So moved. Support.
Any discussion? All those in favor?
Aye.
Those opposed? Motion carried. Okay, item 4, is there a motion for approval of the 3-year agreement with Garsky Hewitt PLC and Martin Law for 2 one-year extensions?
So moved.
Moved by Mr. Herrick,
Support.
supported by Mr. Coonan. Any discussion? All those in favor?
Aye.
Those opposed? Motion carried. And then item 5, is there a motion for authorization to develop and release the bid for access control systems?
So moved.
Support. Moved and supported. Any discussion? All those in favor?
Aye.
Those opposed? Motion carried. All right, moving on to item 8. Are there any referrals? Item 9, unfinished business. New business. Mr. Herrick.
Why, thank you. I think I've been thinking about the effectiveness of our Zoom meetings and how well it's been received, and still how we're not out of the woods yet on this whole thing with the COVID. And we like to think we are, but we aren't. And there's a lot of new variants going around, not this one in particular. And I don't think we probably haven't seen it come around here yet. And I also think of the access that the rural townships, you know, you can talk about Gibson and Mount Forest, and where those people mostly are unvaccinated, you know, we know for the most part. And I think the Zoom has been an effective way for them to still communicate and without attending in person. And even people who come here, some people just don't feel comfortable coming in here. And if they do, a lot of them could be sick and we don't know. And it doesn't, just because we are vaccinated doesn't mean we can't get sick. And I certainly don't want to. I'm glad, you know, we haven't. So it's been good. So I guess what I'd like to do is I'd like to make a motion to continue with our state of emergency for 90 days, and if the school will be back in session, then we'll have a little bit more information, I think, to go on, and I think we'll probably have a better idea of where we're at than where we're at right now. So that would be a motion I would make.
Support.
Okay, any further discussion, Mr. Cronin?
Where do we currently stand? And because we've done that, Jim, you provide.
Yeah, it's an option, creates flexibility for both the public that would like to speak at public input. But I know up in, for example, Gibson Township, it's a very small township hall, one room in the audience. And, you know, well, this is one room as well, but it's much smaller than these chambers. But I think the townships I haven't heard from the cities, but I think the cities extended theirs on, but I've gotten nothing but positive feedback from people that they have the option to choose to be more flexible.
Mr.
It's not required. So.
Okay, Mr. Kreger?
Yeah, Joel, can you respond to the status as far as cases? Have you heard other communities, are they extending their time?
Okay, so I guess the best way, cases are down across Michigan and especially in Bay County. And currently right now we're at the lowest point in the number of confirmed cases since the beginning of the pandemic. On average, we see about maybe 1 or 2 confirmed cases per day in the last 2.5 weeks. That's great. I mean, it's really given us respite here at the health department, and cases are down across the state. We anticipate that cases are going to increase after this 4th of July holiday. I'll be able to give you a better read on that by the end of the week and in the early part of next week. But we also anticipate with the Delta variant that's much, much more highly transmissible. And while vaccinated persons are pretty much still protected to the same degree that they were with some of the other variants, unvaccinated persons or persons that only have 1 dose of a 2-dose regimen are going to have, they're more highly susceptible to illness, and especially if you're unvaccinated, you're more susceptible to serious illness with this particular variant. Now, across the state of Michigan, it's kind of a mixed bag with some of the counties and municipalities as far as the state of emergency goes. I know that in like Southeast Michigan, state of emergencies have been extended to a greater extent. Some of the more rural counties, you don't see the state of emergency in place anymore, or some of them didn't issue one in the last couple of months. And it really depends too on how aggressive this variant is going to be. It's not a matter of if, it's a matter of when. And it's also, but the if is going to be if we get enough people vaccinated. Right now, the vaccination rate for at least just 1 dose in Bay County for persons 12 and above is about 55%. Persons 20 and above, it's almost 60%. when you talk about full vaccination rates, those numbers drop considerably. So about a little under 50% right now of all adults are fully vaccinated. There's still quite a number of adults that either have one vaccine and haven't gotten their second dose for one reason or another, or have just chosen not to be vaccinated at all. The good news is, though, that seniors are vaccinated, fully vaccinated in high numbers here. And I'm really happy to say that that's across the county, even in some of the more northern parts of the county, like in county, 85% of all seniors are fully vaccinated. There are parts of the city of Bay City where we figure it's pretty close to 100% for seniors. And those numbers start to go down as you go down the age categories. Surprisingly, though, or not surprisingly, one of the lowest age categories is the 20 to 29-year-old age category. And when you compare their numbers to the 16 and 19-year-olds, it's like night and day. 16 and 19-year-olds are outperforming or outpacing vaccinations for the 20 to 29-year-old by about 10, 15 percentage points. I think one of the things that could spread the virus in the coming weeks and months is indoor activities, especially school with unvaccinated students. But we're on a wait and see position right now. Hopefully that the vaccine will be approved for children. Right now it's approved for the Pfizer vaccine's approved for 12 and above, and we expect that any day now Moderna will be approved for 12 and above as well. So there's no right or wrong answer as far as, you know, what's the consensus out there in the state of Michigan. It's kind of a mixed bag as you go county to county.
Thank you, Madam Chair.
Mr. Greger.
So based on the information you just shared, at this point, I feel it's, you know, in the best interest to try to get back to some normalcy that we've not had. And we've been working towards that, so I'm not going to support this motion. Thank you.
Anybody else wishing to? Mr. Cooney?
Just a question. I don't have a problem supporting it. I guess I just want to understand it. If the city can adopt extended, and why can't, do we have to do this for the townships, or how does that work?
We do. The law this is basically for purposes of the OMA, for the Open Meetings Act. That's the only reason this would be extended. What this would do is allow the different municipalities that are out there, if they wanted to allow either the public or if they wanted to allow members of their board to attend remotely, each board would have the option to do that. They're not required to, but it gives them the option to do that. But the way the current OMA is written, the county is required to have a county-wide state of emergency that encompasses those municipalities. It can't be one of the smaller municipalities that is making that.
But the city can adopt it.
The city adopted theirs. There's nothing in the OMA that specifically states that the city's state of emergency will override the OMA, but if the county also issues a state of emergency, the city is encompassed by the county.
Okay, thanks.
Any other discussion?
I just know as a general practice, there have been people who have contacted me that I've been able to give the Zoom links out that wanted to know what was going on but weren't comfortable coming in, or they knew they had somewhere, they were at work. I mean, 4 o'clock is, some people are still working, and they wanted an opportunity to be able to hear what was happening and yet still be able to be where they also needed to be. And this is an option where you can actually get a lot more public interaction, public awareness. I mean, I know right now we're just worried about being able to do a state of emergency to be able to extend that opportunity for other people to be able to Zoom in. But I would, if there was any opportunity for this to become a permanent type feature that we would allow for people to be able to communicate and watch in, I'd be all for that. Because I know there's several people that have enjoyed this opportunity to be able to participate when before they really didn't feel like they had any.
Mm-hmm. Okay, do you want me to do roll call individually? I get to have a choice? All right, we're going roll call individually then. Yes.
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 Garrett,
Yes.
Johnson,
Yes.
Krieger,
No.
Fox,
Yes.
motion carried 6-1.
Okay. Ms. Davis Johnson, is there any reason to go into closed session?
There is not, Madam Chair.
Okay. Miscellaneous?
Announcement. Auburn Corn Fest starts Thursday, the 8th, 9th, 10th, and 11th. The parade is Sunday at 1, and there's all kinds of activities going on. I think it's a full Corn Fest this year, beer tent included.
And it's ventilated. There's lots of air in that tent. Very, very good.
No zooming?
No Zoom. I've not been able to partake in a beverage via Zoom.
That'd be interesting.
Okay.
Madam Chair? I
Yes.
move to adjourn.
Wait, not yet. I have an announcement too. On July 21st in Penn County, the Northern Bay Scholarship Fund is doing a Pints for Paws fundraiser for benches for their animal park. It's at CJ's. It's from 5 until 8. Okay, now you can.
Move to adjourn.
All those in favor?
The big rat.
Motion carried.